Hi guys, my name is Iqbal and today I'm going to talk about iliotibial band syndrome. So first, you need to know what is tendon. Tendons are flexible, elastic like fibrous tissues that connect your muscle to your bones. Your tendons pull on the bones when you squeeze a muscle and that makes your bone move. And then we need to know what is iliotibial tract. The iliotibial tract is a thick band of fascia that runs on the lateral side of the thigh from the iliac crest and inserts at the lateral epicondyle of femur. It is composed of dense fibrous connective tissue that appears from tensor fascia latae and gluteus maximus. And now we are going to talk about iliotibial band syndrome. ITB syndromes occur when ITB gets irritated or swollen from rubbing against your hip or knee bones. It rubs against your bone when it gets too tense. There are many reasons why your iliotibial band might tighten. Your ITB gets irritated and swollen when it stretched too tight and rubs against bone. Possible cause of a tight iliotibial band include: first, excessive foot pronation. Your foot naturally rotates outward. That stretches the ITB band and brings closer to your bone. Second cause is hip abductor weakness. Abduction of the hip is when your hip turns away from your body. A weakened ability to rotate your hip might cause your ITB to tense. The third one is internal tibial torsion. Internal tibial torsion is when your tibia is twisted inward towards your body. This pulls your ITB band closer to your bone. The fourth reason is a pre-existing ITB band tightness. It is possible that you just happen to be born with a tighter ITB. And lastly, your tight ITB might rub against your bone for reasons that include cooling down too quickly after exercising, lack of rest, not stretching enough before exercising, pushing yourself too hard during exercise, running on a tip or a curved surface, running downhill, and warming up too quickly. First symptom is hip pain. Your ITB band repeatedly rubs against your greater trochanteric in your hip. Your greater trochanteric is when the bone widens near the top of your femur. The friction causes inflammation in your tendon. Second symptom is knee pain. Your lateral epicondyle is on the outside of your knee, near the bottom of your femur, where the bone widens. Your tense ITB repeatedly rubs against your lateral epicondyle when you flex and extend your knee. The friction causes inflammation in your tendon and pain in your knee. The third symptom is warmth and redness of knee. The outside of your knee might look discolored and feel warm to the touch. At first, the pain will start after you exercise. As the symptom worsen, you feel the whole time you exercise and eventually also when you are resting. People with ITB syndrome describe the initial pain as aching and burning. The more they exercise their leg and the worse the symptom gets, the sharper the pain turns. Healthcare provider might diagnose you with ITB band syndrome after discussing your history of exercise and symptoms and performing a physical examination. The first one is grating sounds or a grating feeling. Repeaters when knee or hip move. Second one is pain over the greater trochanter in one or both of the hips. Pain at the lateral epicondyle in one or both of knees. The fourth one is pain that increase for longer duration of exercise. Pain that worse when walking downhill. And lastly, healthcare provider might perform a test called the Nobel and Ober test.
With the patient in the supine position, grip the ankle with one hand and lift the leg from the table, flexing the knee to 90 degrees. With the fingers of the other hand, apply pressure over the iliotibial band in the region of the lateral epicondyle. Then slowly extend the knee while maintaining the pressure over the lateral epicondyle. This test is considered positive if the patient complains of pain at the lateral epicondyle during the procedure. This pain is typically most pronounced at approximately 30 degrees of flexion. This indicates involvement of the iliotibial band. To perform this test, ask the patient to lie on the uninvolved side. Place one hand on the pelvis to stabilize the patient's position and the other under the inner aspect of the knee. Abduct and extend the hip to bring the tensa fasciolata over the greater trochanter. Then lower the limb or ask the patient to lower it towards the table. This test is considered positive if the involved limb fails to adduct to the extent expected when compared to the uninvolved side. This indicates contracture of the tensa fasciolata and the iliotibial band.
The first one is pain medication. Example of NSAIDs include ibuprofen and naproxen. The second one is physical therapy. Physical therapists can teach how to stretch, strengthening exercise, and other treatments to help relieve hip and knee pain. These treatments might help lengthen the ITB, decreasing the tension. Physical therapists can also show you how to warm up correctly. Next are posture training and rest. The way to hold the body when doing daily activities, playing sports or otherwise, might influence ITB syndrome. Some experts recommend not to exercise until the pain is gone and the ITB syndrome has healed. The last one is steroid injection. Corticosteroid might reduce the inflammation in your ITB. And if medication and physical therapy don't work, healthcare provider might recommend surgery. That's all from me. Thank you. Bye.